Surgeons who rebuild damaged knees say there is one exercise that matters more than any other for weak, unstable knees, and it has nothing to do with walking or stretching. The exercise targets your quadriceps, the muscles that act as your knee's natural brace. When those muscles weaken, and they weaken fast after 75, standing up becomes a negotiation. You grip armrests. You lean forward. You wonder if today is the day your knees give out completely. But that weakness is reversible. This single movement rebuilds what your knees have lost, and you can do it from a kitchen chair. Nobody thinks much about their quadriceps. You notice your knees when they ache, your back when it locks up, your hips when they throb at night. But the muscle that runs down the front of your thigh, the one that straightens your leg every time you stand, every time you climb a step, every time you catch yourself from stumbling, that muscle stays invisible until it can no longer do its job. And by then, the weakness has been building for years. Your quadriceps, often just called your quads, are 4 separate muscles that wrap around the front and sides of your thigh bone and attach just below the kneecap. Together, they form the largest and strongest muscle group in your entire body. And they serve one critical purpose when it comes to your knee. They absorb force. Every step you take sends impact upward through your leg. Your quads intercept that impact before it reaches the cartilage, ligaments, and bones inside the knee joint. According to the American Academy of Orthopedic Surgeons, strong quadriceps and hamstrings help the knee joint absorb shock, and the less strain on the knee, the better the chances of preventing pain and further injury. Think of your quads as a set of springs sitting between you and the ground. When those springs are strong, the knee barely registers the load of standing up, walking across a room, or stepping off a curb. When those springs are weak, the knee absorbs every pound of force directly. And that is where the trouble begins. After 75, the trouble accelerates. The problem is not simply that the muscles shrink. According to a quantitative review published in Frontiers in Physiology, muscle strength declines 2 to 5 times faster than muscle mass in older adults. Your quads can look roughly the same size on the outside while losing the ability to produce force on the inside. By the time your legs feel unreliable, the strength gap is already large. The pace of this decline matters. Strength loss speeds up after 60. And by your 70s, the drop steepens further. Your quadriceps do not weaken in a smooth, gradual slide. They hold reasonably well for years, and then the fall-off sharpens. The gap between what your muscles can produce and what your daily life asks of them narrows until ordinary tasks become uncertain. A cross-sectional study published in BMC Musculoskeletal Disorders examined this connection directly. Researchers found that lower quadriceps muscle strength was associated with a significantly greater risk of falls in older adults. The chain reaction is straightforward. Weak quads let the knee buckle when you put weight on it. The knee buckles, and you lose your balance. You fall. Falls cause fractures. Fractures lead to hospital stays. Hospital stays lead to the one outcome you are working hardest to prevent, losing the ability to live independently. But your quadriceps can still rebuild, regardless of your age. Muscle tissue retains the ability to grow and adapt in response to resistance training well into your 70s, 80s, and beyond. The muscle does not stop responding. It waits for the right signal. If you give it focused, repeated loading, it adapts. It gets stronger. And the knee benefits immediately. The exercise that provides that signal is the seated knee extension. You may have seen it in a physical therapy clinic, or in a magazine about healthy aging. It looks simple because it is simple. But simplicity is the point. This movement isolates the quadriceps and forces them to contract under load, which is the only way to trigger the muscle rebuilding response your body needs. Walking uses your quads, but it distributes the effort across dozens of muscles and joints. Stretching improves flexibility, but does nothing for strength. The seated knee extension focuses all the work on the 4 muscles your knee depends on most. The American Academy of Orthopedic Surgeons includes this type of movement in their standard knee rehabilitation protocols for that reason. Quadriceps need focused, repetitive loading to get stronger, and the seated extension delivers that loading without forcing your knee through painful ranges of motion. Here is how to do it properly. Sit in a sturdy kitchen chair or dining chair with your back flat against the backrest. Both feet should be flat on the floor, knees bent at a comfortable angle, roughly 90 degrees. Place your hands on the sides of the chair or rest them on your thighs. Keep your upper body still. The only part of you that should be moving is your lower leg. Slowly straighten your right leg out in front of you. Take about 3 seconds to extend it. Do not kick the leg out or let it snap straight. Control the movement the entire way up. As your leg reaches full extension, tighten the muscle on the front of your thigh. You should feel the quad contract firmly, almost like someone placed their palm flat against the muscle and pressed. Hold that contraction for 3 to 5 seconds. Breathe normally while you hold. Do not hold your breath. Then lower the leg back to the starting position slowly, taking another 3 seconds on the way down. That controlled lowering is just as important as the lifting. It trains the muscle to manage force in both directions, which is what your knee needs when you walk downstairs, step off a curb, or lower yourself into a car seat. Repeat 10 times on your right leg. Then switch to your left leg and do 10 more. That is 1 set. Work toward completing 2 to 3 sets on each leg, with about a minute of rest between sets. The whole session takes less than 15 minutes. You can do it in the morning before breakfast, during a commercial break, or while waiting for the coffee to finish. The setting does not matter. The consistency does. If straightening your leg fully causes sharp pain inside the knee joint, stop short of full extension. Go to the point where you feel effort in the muscle without pain in the knee. As the quad grows stronger over the coming weeks, your range of motion will improve on its own. Once 10 repetitions feel comfortable, add a light ankle weight. Even 1 or 2 pounds creates a meaningful increase in resistance at this level. Add weight gradually over several weeks. There is no rush. The exercise should feel like work, not punishment. If this is helpful, subscribe to the channel for more videos like this. Your muscles are changing before you feel it. Strength gains from daily quadriceps training do not announce themselves with a sudden breakthrough. They arrive quietly. Somewhere around the 3rd or 4th week of daily practice, small things shift. The grip on the armrest loosens. Standing up takes 1 smooth effort instead of 2 attempts. The walk to the mailbox feels more like a walk and less like a test you might fail. A 2025 systematized review published in Musculoskeletal Care examined multiple randomized controlled trials and confirmed that quadriceps strengthening exercises significantly reduced pain and improved physical function in adults with knee osteoarthritis. The effective protocols in those trials ran 8 to 12 weeks and included movements like the seated knee extension. As the weeks continue, the changes compound. Getting out of a car becomes smoother. Walking speed picks up without you forcing it. The stairs in your house start to feel less like an obstacle and more like something your legs can handle. These improvements do not arrive all at once, but they build on each other. Each one makes the next one possible. The functional changes are the ones you carry into your day. Stronger quads let you push yourself out of a chair instead of hauling yourself up by the armrests. You step over a raised threshold instead of shuffling across it. You walk on uneven pavement, a gravel path, a grassy yard, without that quick flash of anxiety that your knee might fold. You carry a bag of groceries from the car to the kitchen without mapping out places to stop and rest along the way. These are not small improvements. These are the movements that separate independence from dependence. A large BMJ network meta-analysis published in 2025, covering over 200 randomized controlled trials and nearly 16,000 participants, confirmed that strengthening exercise was among the most beneficial interventions for improving function in adults with knee osteoarthritis. Orthopedic specialists have made this recommendation for decades. The research now firmly agrees. 3 common mistakes undermine this exercise. The first is speed. If you swing your leg up and let it drop, you use momentum instead of muscle. The quad barely fires. Slow, controlled movement is what forces the muscle fibers to activate and adapt. If you cannot feel the quad tightening at the top, you are moving too fast. 3 seconds up, hold 3 seconds down. Every repetition. The second is inconsistency. Your muscles respond to regular, repeated signals. Doing a large number of repetitions once a week produces almost nothing. Doing a smaller number every single day produces real, measurable change. Think of it like watering a garden. A flood once a week does less good than a steady drink every morning. Even on days when you feel stiff or tired, 10 extensions per leg keeps the rebuilding signal alive. The third is quitting when the pain eases. Once your knees feel steadier, the temptation to stop is real. But the strength you built will fade within weeks if you stop training. This is not a course of treatment you finish and move on from. It is maintenance, the same way brushing your teeth is maintenance. The day you stop is the day the weakness starts returning. If you have had a recent knee injury, knee surgery, or a joint condition that requires medical monitoring, talk to your doctor or physical therapist before starting. The seated knee extension is one of the safest lower body strengthening exercises available, but your body is yours. A brief conversation with your provider helps you adjust the repetitions, the range of motion, or the pacing to match what your knees can handle right now. If you ever feel sharp pain inside the joint during the movement, stop. Muscle fatigue is normal and expected. Joint pain is a signal to modify or get professional guidance. The seated knee extension will never make headlines. Nobody films a recovery montage of someone sitting in a kitchen chair, straightening one leg at a time. But the woman who stood up from her daughter's couch without asking for a hand. The man who walked to his mailbox in February and never once thought about whether his knees would hold. Those quiet moments are what this exercise builds toward. Your knees carried you this far. Give them the muscle they need to keep going. More videos like this are on the channel.